A federal study published by the Centers for Disease Control and Prevention on Friday of Rhode Island child care centers shows there is evidence towards safe reopening despite the COVID-19 pandemic, according to CDC Director Dr. Robert Redfield. The study looked at COVID-19 infections coming out of child care centers across Rhode Island between June 1 and June 31. June 1 was the date that the state's child care programs were allowed to reopen following strict safety protocol because of the declining spread across the state. When things are done with vigilance, in partnership with the public health community, that you can in fact, be able to reopen child care and not have significant secondary transmission, Redfield said, according to the Washington Post. By July 31, 666 child care centers were allowed to open with a capacity for 18,945 kids, the study stated. It did not, however, mention how many staff and children were actually in attendance during that time period. In those 2 months, 52 children and adults were infected across 29 child care centers, according to state health department investigators. Only 4 of the 666 centers had cases that could have spread the virus, the study stated. Part of the safety protocols child care centers needed to follow included only allowing 12 people, at first, and then 20, including staff. Masks were required for all adults and both adults and children were screened for symptoms daily. I think this is an inspiring article to tell individuals that there is a path where one can use and partner with their public health authorities and safely get these child care programs reopened, which again, are very important for our country, he said. And again, as an extension, we're trying to get these schools reopened. Centers that experienced a person with symptoms were required to close for 14 days. Rhode Island's Department of Health quarantined and monitored those infected during that time too. I really do believe strongly that it's in the public health interest to get the K-12s back to face-to-face learning, and we just have to work collectively to do that in a safe and sensible way, Redfield added. One school, one jurisdiction, one family at a time.